Knock knock.
Come in.
Hi Brittany, my name is Brandy. I'll be your nurse today. Can you please tell me your last name and date of birth?
There on November 18th, 1993.
Okay, and can you tell me what year it is?
2013.
And the date today?
Friday, December 13th.
Okay, and can you tell me who the president is?
Barack Obama.
Alright, very good. Checking your name down. It says here you have no allergies, is that correct?
Yep.
Alright, so you're at the hospital. What brings you in?
Respiratory distress.
Okay, are you feeling short of breath at all right now?
No.
No. Are you a smoker?
No.
Do you have a family history of COPD, emphysema, or lung cancer?
Yes.
Okay, you do. Is there anything that makes your breathing worse that you've noticed?
No.
Are you in any pain right now?
No.
Okay. Well, if it's okay with you, I'm just going to perform a little assessment and see if we can find a problem so we can let the doctor know. First thing I'm going to do is listen to your lungs. Okay, so I know that you're having some trouble breathing, but if you feel dizzy or lightheaded at all, please let me know and we'll stop. I'm going to listen to 4 spots anterior, 2 lateral, and then we'll listen to the posterior side. We'll start above the clavicle. You take a nice deep breath in through your nose and out through your mouth every time I move the stethoscope. Okay, and then we'll listen to 2 spots laterally. One more. Just one more on this side. Okay, very good, Brittany. Thank you. Now, if I can just have you turn around and we'll listen to your lung sounds on the back side. Alright, we'll listen to 6 pairs on the back side, starting at about the C3, and Brittany, just in through your nose and out through your mouth again. Go ahead. Okay, just one more. Very good. You feeling okay?
Mm-hmm.
Alright. Now I'm going to check her lung expansion at the T9. I can just have you take one more deep breath in and out. Okay, lung expansion seems symmetrical. And now I will percuss. Resonant. 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 Alright, very good. Now Brittany, if I can just have you repeat the words 99. Just continue repeating the words 99 until I say to stop, okay? Go ahead.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, very good. Tactile fermitus is negative. The vibrations were diminished going down. Now I'm going to do a test which is called egophony. And I'm going to listen with my stethoscope, and I'm just going to have you say the letter E every time I place my stethoscope in a different spot. So you can start. E, 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 E. Okay, very good. Egophony was negative. E was heard throughout the lung fields and was getting diminished towards the bottom section here. Okay, Brittany, I'll have you turn back around now. And while she's just sitting here, I would want to just inspect her. Her skin color appears normal. It's pale to pink. Her posture is sitting upright. She doesn't appear to be using any accessory muscles to breathe. Her facial expression doesn't show that she's in any pain at all. Her anterior posterior ratio is 1 to 2, which is normal. And she doesn't say that she's in any pain right now. And then I will, can I have you put your fingers together like this? Checking for any clubbing finger, and I don't notice any, so that appears normal. Very good. And then I will do her neural assessment. I'm just going to flash this light in your eyes to check your pupil response. Okay, the pupils are equal, round, and reactive to light. Now if I can please have you stare at the clock up there, and then take a look at me. Okay, pupils are accommodating to light as well. And next we'll check her motor function. Brittany, if I can please have you just squeeze onto my fingers as hard as you can. Okay, +5. And now I'll have you place your hands like this. And press up as hard as you can. +5. And down as hard as you can. +5. And now press towards me as hard as you can. +5. And then towards yourself. +5. Okay, very good. And I'll check on the lower extremities as well. Alright, pull your legs towards you. +5. Towards me. +5. And push your feet down. +5. And feet up. +5. Very good. So while I'm down here, I'll just want to check her both lower extremities. Don't have any, show any swelling or edema noted at all. So next, I'll just check her cap refill since I'm down here on each big toe. Right side less than 3 seconds. Left side less than 3 seconds. I'll also check fingers. Less than 3 seconds on the right. And less than 3 seconds on the left. Okay, Brittany, now I'm going to check your reflexes. Check your left arm first, the tricep reflex. Very good, just keep your arm dead. +2. Keep your arm limp. +2. Now we'll check the patella. +2. And a +2. That's very good. Next we'll listen to her heart sounds. And I will find her sternal notch down to the angle of Louis, and we'll go to her right side. Second intercostal space is where I'll hear the aortic valve, also known as the S2. And I'll listen second intercostal space on the left side, pulmonic valve. Okay, and then we'll go down to fourth intercostal space, which I'll hear the Erb's point. Fifth intercostal space on the right side would be the tricuspid valve. Fifth intercostal space on the left side is where I'll hear the mitral valve, also known as the S1. Okay, and since I'm at the fifth intercostal space, the mid-clavicular line, I'm going to check her PMI. So Brittany, if I could just have you lean forward and almost give yourself a little bear hug. Okay, PMI appears normal. There's no thrills or heaves noted in her chest walls. Very good. So Brittany, the next thing I'm going to have you do is please use the restroom to empty your bladder, and then we'll continue with the abdominal assessment. So while she's walking to the bathroom, I'm just noting her balance appears normal. Her gait is not off balance at all. Okay, very good, Brittany. If I can just have you stand right here and just stand on your left foot. Okay, and then stand on your right foot. Very good. Alright, and then I'm going to just do a sensory test. If you could close your eyes, I'm going to just poke your hands, your left or your right hands, with my hammer. And we're going to call this side the sharp side, and this side the dull side. Okay, sharp, dull. So you let me know whether I'm touching you with the sharp side or the dull side and on which hand.
Sharp right, dull right, dull left, sharp left, sharp right.
Okay. Sensory seems good on the upper extremities. Alright, Brittany, you can sit down and I'll have you lie back. Okay, scoot all the way up on the pillows. Okay. And she's at a 45-degree angle, so the first thing I would have her do is if you can just turn your head to the left. And I don't notice any jugular vein distension at all. So now with the bell side of my stethoscope, I'm going to listen to her carotid arteries. Okay, Brittany, if you can just please take a deep breath in and hold it. Okay, good. Now the other side, keep holding it. Okay, very good. There's no brewery noted there. So the next thing I'm going to do is check her peripheral pulses. Okay, temporal pulse +2. Now listen to each carotid individually. +2. Right side. +2. Put your arms out. Brachial +2. Radial +2. Ulna +2. Femoral +2. Popliteal +2. Dorsal pedius +2, and the posterior tibia +2. Okay, Brittany, very good. Now I'm just going to lift up your shirt and inspect your abdomen. Okay. So first thing I want to do is just inspect the abdomen. Note symmetry is contour, and there's no ascites noted. I don't notice any scars, any lesions. The coloring appears normal. I don't see any pulsation at all. Brittany, if I can just have you please lift your knees up. Okay. And then I will check for any hernias. If I can have you cough. And just raise your head a little bit like you're doing a crunchy. Okay. And there's no bulging there at all. You can place your feet back down. Are you experiencing any pain in your abdomen?
No.
Okay. And I've just had her use the restroom. So I'm going to start oscillatating in the right lower quadrant first. Just dividing her stomach into 4 sections across her umbilicus both ways. Active, 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 active. And now using the bell side of my stethoscope, I'm going to check her aortic arteries, just 1 inch above her umbilicus. Okay, no brewery. And the renal artery, 1 inch to the left and 1 inch to the right. No brewery. And then I will want to palpate using one hand. Brittany, please let me know if you feel uncomfortable or if there's any pain while I'm doing this. So I'll start in the right lower quadrant as well, and while I'm palpating, I'm just watching her facial expression to see if she's grimacing or has any involuntary movements at all while I'm palpating that might indicate that she's in pain. And I don't notice anything, so that appears good. Then I'll percuss. Tympanic. 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 Alright. Very good, Brittany. Thank you. And now I'm just going to check her Babinski reflex at the bottom of her toe, starting at the heel and moving inward. Okay, that's good. Her on both sides, her toes reflexed in, they didn't flex out, so that appears to be normal as well. while I was